The coronavirus pandemic means big changes to Governor Newsom's budget, forcing billions in cuts. Good evening and thank you for joining us. I'm Carlo Cicchetto.
And I'm Barbara Lee Edwards. Just 4 months ago, California enjoyed a surplus of $5.6 billion. Today, the state faces a massive $54.3 billion deficit. News 8's Brandon Lewis explains what it all means.
Carlo and Barbara Lee, this is one of the state's worst budget deficits at $54 billion. Governor Newsom today laid out a broad series of cuts aimed at curbing it, but he also called on the federal government to step up and do more to help states not only like California, but across the nation dealing with budget crisis from coronavirus.
We clearly, the time had an expectation that this was serious, but none of us had a sense of how serious. The focus appropriate at the time was public health.
It's a doomsday scenario for the state budget as the governor laid out broad cuts in the start of the economic fallout from the pandemic.
Just like that, almost a blink of an eye.
California is facing a more than $54 billion deficit. While some will be covered by the state's rainy day fund, Newsom is proposing cuts to salaries, pensions, and planned improvements to public services, like an expansion of preschool and health care.
Behind every category is a dream that is either deferred, in some case, a dream that is denied.
The governor argues California is better positioned than it was in any of the past downturns because of budget reforms that saw the state have a surplus last year. The Federal CARES Act will also help cover roughly 15% of the deficit. Newsom is calling on the federal government and specifically President Donald Trump to do more by passing the HEROES Act. It would give $500 billion in assistance to states to cover the financial impact of coronavirus, but Republican senators oppose it because of the bill's many other provisions that would substantially add to the nation's debt. Newsom, though, says that money could prevent many of the cuts to existing programs.
The federal government has a moral, an ethical, and economic obligation to help support the states. After all, what is the point of government, if not to protect people, their safety, and the well-being of citizens?
We have Governor Newsom's entire budget proposal on our website, cbs8.com, so you can review it. Coming up for you new at 6:30, we'll talk a little bit more about the impact that unemployment is having on this deficit. Carlo and Barbara Lee.
Some breaking news for you now. The city of San Diego will reopen 3 of its reservoirs for public recreation this weekend. The Miramar and Murray reservoirs will open Friday, followed by Lower Otay Reservoir on Saturday for walking, jogging, cycling, fishing, and boating. County health officials are reporting 113 newly confirmed cases of COVID-19 in the meantime, bringing the total to 5,391. The 113 positives represent just 3% of the nearly 4,000 tests performed, and that is the single highest number of tests performed in a single day. There were 6 deaths reported, bringing that total to 200. County leaders have spoken with members of local tribal nations about scheduled casino reopenings. Public Health Officer Dr. Wilma Wooten said during a previously scheduled meeting this morning that she met with tribal leaders to discuss their plans. They submitted plans for reopening to the county, and she will review them, but in the end, it is up to each tribe.
It is very clear to us that tribal nations have sovereign authority. And it is also very clear that the county and the tribes share a mutual interest in protecting the health of the community.
Free meals a day.
Also announced today, older San Diegans can now sign up for the Great Plates Delivered program. It's part of the state's initiative to get seniors healthy food and get restaurant employees back to work.
This comes as little surprise. San Diego's unemployment rate has reached record levels. A new report released by Sandag today says the county unemployment rate reached nearly 29% this week. That's worse than the 2008 recession and the Great Depression. But the numbers are easing up, and Sandag economists say they think the worst economic hit is behind us. Analysts say just under 500,000 San Diegans are jobless right now. And with so many people out of work in California, it's nearly impossible to get in contact with the state agency handling unemployment claims. News 8's David Gottfredson spoke with a Mira Mesa man who has been trying for the past 7 weeks to get his benefits.
Oh, the experience has been horrible.
43-year-old Terrence Davis is at the end of his rope with the State Employment Development Department.
Because of COVID-19, I am laid off because of lack of work.
For the past 7 weeks, Davis has been trying to get unemployment money. He's been living in Tijuana since he got laid off from his job as a service technician repairing industrial kitchen machinery.
Now I'm at the point of, trying to face a homeless situation because of it. I have to pay my bills.
He applied online for unemployment benefits and was denied because he had only worked for 5 months at his most recent job. He amended his claim to include previous employers, but received no response to his emails.
I'm a hard-working, tax-paying citizen, so, I've been working over 20-something years in my life with no problem, so I feel that it's my right to draw my benefits.
Davis says the phone lines are just as bad.
We are currently receiving more calls than we have capacity to answer.
When I called EDD, I was put on terminal hold, listening to elevator music. So I'm on hold with the unemployment department, but this line will only give you general assistance. The people, if and when they answer, can't actually pull up your individual case. I gave up after a half an hour. I can only imagine what that feels like for someone who has lost their job.
With all of the billions of dollars that's coming through the state, I mean, come on, man. It's only pennies what I'm asking for, and just to try to survive, and this money that's owed to me. I mean, can I get my money?
David Gottfredson, News 8.
We reached out to public information officers with the state employment agency, but we have not heard back. We'll let you know if they respond with any updates. Nationally, nearly 3 million people filed for unemployment benefits last week, even though most states are now allowing some businesses to reopen. That brings the total number of unemployment claims over the past 8 weeks to 36 million.
A sailor cleared to return to duty aboard the USS Roosevelt has tested positive for coronavirus. According to CBS News, the sailor exhibited symptoms and then later tested positive and was taken off the San Diego-based ship. A senior Navy official says it's probably not possible to make the Roosevelt COVID-free, and the ship will likely have to rely on masks, social distancing, and constant cleaning.
The CDC released its long-delayed reopening guidance for schools, businesses, and other organizations today. For schools, the CDC says the following questions need to be asked. Will reopening be consistent with applicable state and local orders? Is the school ready to protect children and employees at higher risk for severe illness? And is the school able to screen students and employees upon arrival for symptoms and history of exposure? A no answer to any of those questions means a school should not reopen. Answering yes to all three moves you on to a different set of questions. There are also tools available for workplaces, camps, child care centers, mass transit, bars, and restaurants. For more information, go to CBS8.com and click on this article.
Well, emergency doctors have seen a steady flow of coronavirus patients. They've been seeing a decrease in other serious cases. Urgent care facilities say the number of patients has dropped by more than 50% since March. News 8's Heather Hope spoke with a doctor about what's driving the trend.
And in fact, we've actually seen quite a reduction in the number of patients that have gone to the emergency department.
Emergency Dr. Eric Lovell is not seeing enough patients in serious condition coming in for treatment during the coronavirus pandemic.
It's like, where did those patients go? And the fact is that some of them are staying home, ignoring some of these serious symptoms.
Following strict stay-at-home orders and overlooking the health signs, sending hospital visits in a decline.
Many of the local emergency departments and urgent cares have seen a substantial drop during the first month of the pandemic, with about a 50 to 70% reduction here locally in the ERs and the urgent cares.
73-year-old Tom Doyle of Rancho Bernardo recently has shortness of breath.
I tried to take a walk to get myself back into shape, and I only got about a block and I was shot. So I thought I had COVID.
But his wife thought otherwise.
My wife interjected and she said, "This is not COVID. This is your heart."
He called his doctor at Sharp Re-Stealing and did a telemedicine call before a nurse told him to come in right away. But Tom had some doubts due to hospitals dealing with coronavirus.
She said, "Don't worry about it. They're empty. There's nobody there. They're going to be able to take you right in."
Tom has no history of heart trouble and was relieved the emergency room wasn't full at all.
I didn't see any other patients. I was totally isolated from other patients. The only people I saw were hospital personnel.
Dr. Lovell diagnosed Tom with a life-threatening blood clot in his lung.
He required immediate hospitalization and a special procedure, an injection of medications to dissolve the blood clot. This massive blood clot in his lung would kill most patients.
But Tom's a fighter and was treated starting Wednesday and home by Saturday.
I'm feeling great. I'm back to doing my exercises. Unbelievable.
Doctors say Tom doing well is a testimony to the need to seek medical care sooner than later and beware of unusual symptoms.
You can't let this go. It's too dangerous.
Heather Hope, News 8.
And that is the practical side of things. You can't let things go if it looks like your health needs to be looked after, but you can understand why patients are hesitant to go in and have something looked at right now. Sort of feel for people on both sides.
Yeah, they don't want to overreact and they don't want to expose themselves, but you got to listen to your body.
Absolutely. Well, tomorrow, look to the skies. They will briefly be taken over by the U.S. Air Force Thunderbirds.
The demonstration team will fly over the skies of San Diego and Los Angeles tomorrow afternoon to honor first responders, healthcare workers, and essential employees.
Our goal is to say, we're here. We're in this together, right? We're all in this together. We may be distant, but we're doing this together.
Tomorrow's flyover will start here around noon and last for about 15 minutes. You're reminded to maintain quarantine protocols, so don't congregate in groups to watch the show. For the first time ever, one of Ocean Beach's most popular events is being postponed. That's coming up next. Plus, how 23andMe is using genetic testing to help answer questions about coronavirus symptoms.
Man, it was beautiful today. Lots of sunshine out there, a few passing clouds, near seasonal temperatures. Well, we're going to take more of that over the next couple of days. We'll take a look at your complete forecast coming up.
And if you get your temperature checked before going into a store or restaurant, will the results be accurate? We'll take a look.